40% of menstruating women are iron deficient. 90% of pregnant women are iron deficient.
Wow.
And when we don't have enough iron, we can't deliver enough oxygen. And so that's where the fatigue associated with iron deficiency comes from. And so everybody has a different experience of their iron levels. And so where you feel at 30 or 40 or 50 or 60 or 100 is going to depend on your physiology and your biochemistry. And so if you get to know your body and track those numbers, then that 32, even though it's normal for you, may make you feel as though it's a 5. Make sure you've had the opportunity to do a very thorough investigation of your iron levels with someone who's going to take you and your goals and concerns seriously.
Hi, everyone, and welcome to Walk with Wisdom, a lifestyle show on youthful aging, which is looking good and feeling amazing as you age. Today, I have an amazing guest, Dr. Leigha Saunders. Hi, Dr. Leigha.
Hi, Genevieve. Thank you for having me.
Thank you so much for being on the podcast today. I'm going to do a mini intro about you to our guests. And I say mini intro because Dr. Leigha has accomplished so much already. And I look at her and she looks so young. She looks 25. You know, we talk about that on this podcast. And yet she's accomplished so much. So we're just going to jump right in. This is going to be a show for all us girls. Perimenopause, menopause, hormones. But it's going to be a foundation of iron. And Dr. Leigha is the expert on iron. So, Dr. Leigha Saunders, how did you get started in being a naturopathic doctor? Because that is your title, correct? Leigha Saunders, ND?
Yes.
Yes.
Like so many things in life, naturopathic medicine really found me, and iron has found me, I think. And so I started my journey on the trajectory to conventional medical school. I didn't know anything about naturopathic medicine. I didn't know what we could offer. I didn't know how we could position ourselves alongside the conventional system. And after interviewing and being waitlisted at medical schools, it was my now father-in-law who said, "Hey, what about becoming a naturopathic doctor?" And I was like, "What is that? I have no idea. What are you talking about?" And when I started to learn more about naturopathic, what naturopathic doctors do, what naturopathic medicine is, fundamentally, it was a philosophy that spoke to me and why I chose this career, because I want women to feel educated and empowered in their bodies. I want them to feel like they know what's happening and what they can do about it, and to ultimately have a choice. And I talk to my patients so much about, I joke and say, I bring you to the buffet of treatment options. So often we are not given that in our healthcare experience. We're told to do something, that's the way that it has to be, go and do it, but it doesn't feel aligned for us for whatever reason. So I'm really passionate about bringing those choices, which may still be medication, which may be supplements, which may be using dietary changes, lifestyle changes. All of these strategic things can come together. And that's why I really love naturopathic medicine, because we can blend these things so integratively.
Incredible. Thank you, Dr. Leigha. And I love what you said. Okay. I love acronyms, little catchphrases. And when you say you tell your patients, I bring you to the buffet of choices for your health. Is that what
That
you
is
say?
what I say. And people will laugh,
Incredible.
but they really
Yeah.
appreciate it.
Of course. Of
Yeah.
course. And and I know our valued listeners and viewers will appreciate this, because we really are living in a time when we're now more than ever looking to take our own health, well-being, lifestyle choices in our own hands. And you, Dr. Leigha, really help everyone, but certainly we're talking about us girls, us women across the ages with our health, and specifically about iron. So, thank you for letting me know how you got into naturopathic medicine. Now, how many years have you been in practice? And since you've been in practice, I'm going to tie it to iron. Since you've been in practice, why was iron such a fundamental piece for you in women's health?
I've been in practice for 12 years, and the longer I practice, the more I realize I don't know that much.
Oh, wow. I get that.
So I'm always humbled by both my patients and the education that I continue in. And over the past year in particular, there has been a shift in how we interpret ferritin and iron values on blood work.
Right.
And so that was actually a little bit of a catalyst in my practice to really reassess my knowledge, my learning, and how I've been managing and treating patients with iron deficiency.
Right.
And when it comes down to it, 40% of menstruating women are iron deficient. 90% of pregnant women are iron deficient.
Wow.
And so when you look at the women who typically are then landing in a doctor's office, you're going to see a higher percentage because the people who are landing in a doctor's office are going to have a complaint or a concern
Right.
or a goal. And how many women feel tired? Too many. Right?
Of course.
So my practice really focuses on treating women typically between the ages of 35 and 55 who have some intersection or overlap of energy, mood, and hormone concerns and goals. And when you then look at how many of those women are likely to be insufficient or deficient in their iron, it's so many of them. And so really, it's just been an ongoing passion of realizing and appreciating once you really dig into the research and understand how many women are deficient and you actually look at the person who's sitting across from you.
Sure.
This is where I think the system fails so many women, is that we try to put people in boxes.
Mm-hmm.
And that can work for some things, but so often we are missing people and we're not listening to their stories and we're not taking their full symptom picture and putting it all together. And so often a critical piece of that is their iron.
Of course. Dr. Leigha, that's phenomenal. And now, ladies, listeners, viewers, we always tell you, go to your primary care practitioner. Well, here you have Dr. Leigha Saunders, an incredible primary care practitioner. And what I love about what you've said so far, Dr. Leigha, is not only giving women the choices, but making sure that you're looking at the whole person, which is so incredible. Lifestyle, the full picture to get to the bottom as to what's going on. Now, I'm going to be more specific with some iron questions. So we talk about iron, but just out there for everyone listening, why does iron matter so much for women? What does iron do?
Once my patients have an appreciation of this, they always say, I have no idea how much iron did or does. So iron helps us form hemoglobin. Hemoglobin is the oxygen carrying capacity in our red blood cells. And so as your blood is circulating throughout your body, one of its primary purposes is to deliver oxygen to all of your tissues. And when we don't have enough iron, we can't deliver enough oxygen. And so that's where the fatigue associated with iron deficiency comes from. Our tissues don't have enough oxygen, they won't have enough energy. And when our brain doesn't have enough oxygen, that can show up as fatigue, but also things like brain fog or memory concerns or trouble focusing, trouble concentrating. Iron also plays such an important role as a cofactor in so many biochemical reactions in our body. So when we look at something like the production of dopamine, which is our pleasure and reward hormone, which gives us motivation, which helps us feel excited.
Yes, ladies.
We are potentially experiencing a rate limiting step if we don't have enough iron. And so if we don't have enough iron, we may not be able to make as much dopamine. That's where a lot of patients can experience anxiety or depression, low mood, low motivation, brain fog from that lack of iron. And then when we put it into the context of the tissues and not having enough energy, there's also a lot of downstream effects that happen. What do you do when you're not feeling your best, when you don't have the energy? A lot of the things that don't support our health behavior, right? So then you may not feel as motivated to exercise or meal plan or meal prep. You may not sleep as well, even though you're so tired because you're lacking iron and lacking oxygen. One of the key processes of that overnight as we sleep is for all of that oxygen and carrying capacity to replenish and repair our tissues. So if you're iron deficient, no matter how much sleep you get, you won't feel restored. you won't feel refreshed. And that's because your body cannot efficiently repair and revitalize you while you're asleep without that carrying capacity.
Right.
And on top of that, low iron can manifest. One of the key symptoms is restless legs. And so it can be a more overt symptom that's disrupting sleep.
Right.
And see, we can go on and on.
There's
so many
more.
things. And there's more.
more.
What else? Palpitations. So again, when you come back to this idea of lack of oxygen, your body is always innately wise, right? It is full of wisdom.
Yes.
And so whenever we're experiencing symptoms, it's our body's way of trying to get our attention. It's our body's way of trying to compensate. It's our body's way of trying to do something to make up for maybe an extra stressor or deficiency that it's experiencing.
Yes.
So when we look at lack of iron, lack of oxygen, what's going to happen? Our resting heart rate is going to be elevated because our body or our cardiovascular system, our heart, is going to have to pump faster and harder in order to deliver the little oxygen that it does have more effectively and efficiently through the body. And so we'll see this where women will have a resting heart rate just while they're sitting. They'll notice that all of a sudden their heart rate is really high, or they might experience it as like a racing heartbeat, skipping a heartbeat, palpitations where you actually notice your heart flutter. Some of my patients who have been extremely iron deficient will notice when they're working out, the smallest exertion causes their heart rate to skyrocket. They'll feel short of breath because they lack that oxygen carrying capacity, even though they feel like, I should be able to do this exercise. I should be able to climb a flight of stairs and not feel winded. And so a lot of these things can then start to overlap. But as you can imagine, if you're feeling winded and tired and not getting that restorative, regenerative, effective sleep, it causes you to withdraw from all of those things.
Of course.
And so we need those things in our life to maintain and establish and support our health. And so I'm really passionate about helping women have the energy that they need to show up and do the important things that they need to do, not only for themselves, but for all of the incredible things that women do in this world.
Wow. I just say, wow, everyone. And Dr. Leigha, I feel your passion and everyone sees your passion. They can hear it and see it. But a lot of what you're saying, I've been in integrative medicine on a retail and coaching level for about 25 years. And you have put it together like no one else that I've heard about iron and all the different things that it affects. And certainly now I'm on, everybody knows already, I'm in the menopause stage of things. But a lot of what happens follows us through life. And we're going to come back to that because absolutely when women are menstruating and pregnant, we're going to talk about those specific groups and when there's even more of an extra need for iron. But what you just did was very foundational. I thought I knew it and I'm going, oh my gosh, of course it affects your sleep. Dr. Leigha, on those topics alone that you went over, we can have, several hours of conversation. So we're going to keep going, but we might have to come back and have you talk more about iron. So, the next question that's really specific based on what you've said, in your practice, how common is iron deficiency?
If you look at the numbers in the general population, 40% of menstruating women are iron deficient.
That's a lot.
That's a lot.
That's a lot.
And 90% of women who are pregnant are iron deficient.
Wow.
So the numbers are quite high.
Yes.
And there will be increased percentage in different populations. So let's say if we take a person who's menstruating and they have a heavy period, they're going to be at increased risk because of that extra blood loss. Let's take someone who's a vegetarian or vegan. Their diet is inherently lower in iron, and the iron that they are taking in isn't as bioavailable or as easily absorbed as iron that is in animal products.
Right.
Then if you take an elite athlete or an endurance athlete, their need and demand is going to be higher. Then if you take somebody who has some kind of condition of malabsorption, so that could be celiac disease, IBD, so Crohn's or colitis, or another condition that affects their ability to absorb nutrients through their gut.
Right.
Let's say you have a person who is all four of those. a menstruating woman with heavy periods who's a vegan and likes to run marathons
Oh, wow.
and has celiac, because those people exist.
Of course.
And so it's not to say you have to be or have all of those things to be deficient, but when we look across the population, there are different risk factors. So we have a general idea of saying 40%
Yes.
of menstruating women, but then you need to look, this is what I'm saying about, we need to look at the person who's sitting across from us.
Yes.
And we need to look at especially as medical providers, we need to look at the person who's sitting across from us in context of the numbers. So I can't tell you the number of times when I've had a patient, let's say a young mom, she is active, she's exhausted, and she's attributing her exhaustion to be a busy working mom, right? Because that's a story we hear so often, right? And she comes to me because she said, well, I went to my family doctor and I told them how tired I am, and they did my blood work and they told me everything is fine. And so I say, okay, let's take a look at that blood work and then let's see, actually. And so in her particular case, her ferritin was 2 points above the limit at which we would consider her to be deficient.
Okay.
And her doctor told her she was fine.
Yes.
It's not an iron issue. I have had patients do their blood work. They go to the lab once and they do 2 requisitions, maybe one from me and one from their family doctor. Sometimes this happens by accident.
Yes.
And the testing overlaps. And the ferritin, there's always a percentage of error. Right. And so the lower amount of something that you have in your blood, the less accurate the testing is going to be, right? If you have an overabundance of ferritin, it's going to be easier for the test to detect it. So if we're talking about a deficiency, there can be a difference in 5 points. So her 32 level may have been 27 if she had drawn her blood 5 minutes later with a second rec and a second test.
Right.
So, but that is a cutoff. And this is where I'm saying we can't put people in boxes. Right. We always have to look at the person across from us. And if we could look at that person and say, this woman is telling me she's so tired, she's having trouble driving home from work. She's falling asleep as she's putting her kids to bed. She's not waking up rested no matter how much sleep she gets. She wants to take a nap every afternoon. Oh. When you look at that level of fatigue and then say like, oh, well, you're not deficient, it's not good enough, because we need to look at the person in context with the results and say, you know what, you're so close to being deficient. And if you actually read the results, it says if you're between 30 and 50, you're probably deficient.
Wow.
So can we not just take that information and put it in context and say, this is the problem for you, or let's make sure it's not because you're so close to being deficient. Oh, and by the way, she was also bleeding 3 out of 4 weeks of the month. And so when you look at her trajectory, she's going to move into that deficiency very quickly. And everybody has a different threshold of symptoms. And so everybody has a different experience of their iron levels. And so where you feel at 30 or 40 or 50 or 60 or 100 is going to depend on your physiology and your biochemistry. And so if you get to know your body and track those numbers, then that 32, even though it's normal for you, may make you feel as though it's a 5.
That makes sense. Dr. Leigha, that makes sense. I know our listening audience, ladies, and we have a cross-section of listeners, including gentlemen. Please listen to this information for the women in your family. And sometimes we are going to talk about the different age groups. You've hit on some of them, that we have iron needs at different age groups, but a lot of times we have our mom, or sister, or daughter, and there is a missing link and we can't find it in general. It could be her iron. Dr. Leigha, you mentioned something, and I'm wanting you just to explain a little bit more deeply about ferritin. Everybody hears the word ferritin, and you know nowadays we can Google everything and it shows up. But a lot of times ladies aren't quite sure what it really is, what it means. And you mentioned about the levels being different depending on when you take it. So can you just break down ferritin for us?
So ferritin is your storage form of iron. And I like to use a money analogy because everybody loves money and everybody gets money.
Yes.
And so if you think about ferritin, you can think about it like your savings account. Okay, so when we measure your ferritin, we're measuring how much iron do you have in your body stores, how much money do you have in your savings account. We can also measure serum iron, which is the amount of free-floating iron you have in your blood at any given time. That is like your checking account. So what I'll explain to my patients is say, your checking account fluctuates a whole lot. Some days you get paid. Some days you eat a steak. It goes up.
Mm-hmm.
Some days you pay all your bills. You have your period and it's heavy and it goes down, right? So we don't use serum iron as a great marker. It's because it fluctuates so much. We don't use that as the marker of your iron stores or a reflection of how much iron your body has, because it can change day to day. Whereas your ferritin is fairly stable. It does fluctuate across the menstrual cycle, so it will be lowest during the menstrual period and right after, but not enough that we have to time it as a test according to the menstrual cycle. And so if you understand that money analogy, it's like if you have an overabundance of iron or an overabundance in your checking account, you can really easily move that into your savings.
Of course.
Right? And then you can build that nice cushy savings account
Yes.
up. If you are not bringing in a lot of cash, if you're not bringing in a lot of iron, or if your bills are exceeding your income, if your loss of iron is exceeding what you're taking in, then often we have to pull on that savings account, right? And so that's where we'll see our ferritin levels drop. So that's the key difference to understand, because ferritin is a storage. It's like your savings account. Iron is like cash or your checking account.
That, again, Dr. Leigha, I am blown away, ladies. Dr. Leigha is a lot younger than I, and I'm telling you, you have wisdom for your age of explaining something that's seemingly so common, because everybody talks about women's iron, but we don't really understand it.
Mm-hmm.
Talking about it in terms of ferritin, checking, and of course your serum iron, savings, and the differences. Thank you. That was one of the best explanations ever. By the way, everyone, we are going to have Dr. Leigha's contact information during the podcast, and certainly at the end of the podcast, if you want to contact her directly, certainly her social media, etc. Thank you so much for tuning in. And as I've mentioned, we always talk about going to an expert. We have the amazing Dr. Leigha Saunders, ND, and she's here breaking down iron like I've never heard. Thank you again, Dr. Leigha, for being here with us. And we're going to continue. I have more questions for you.
Ask
Can
away.
you take more questions?
Ask away.
I was still thinking, oh, wow, iron affects so many things. So my question is, what are some surprising or lesser known symptoms of low iron?
Mm-hmm. I think one of the things that stands out in my practice for so many women is that they learn how to live with iron deficiency. So I think that's one of the surprising things, because testing ranges have also changed a whole lot over the past number of years. So earlier in my practice, the reference range for ferritin was between 5 and 272.
That sounds like a very wide range.
So I would always say, clearly, if you're a 6 or if you're a 260, you're going to feel very different, right? And I think that was also part of the challenge for me early in my career. I had no reference point of understanding how to categorize people when a reference range is so wide.
Yes.
So, and that's with having the luxury of spending so much more time with them to understand what they're experiencing, but then looking at a number and not really understanding how to contextualize that with them. So now that we have more structured categories to place people in, we understand really what comes through is like the more iron deficient you are for the longer term, the more symptoms that you're experiencing can be related. So I think the primary one that people think of is fatigue, which we've explained.
Yes.
Some of those other lesser ones are how iron can affect mood in particular. So motivation, brain fog, depression, anxiety.
Right.
So when you think about that and the number of people who are challenged by mental health conditions or experience them, they are most of us. And iron plays such an important role in that, and in supporting our mental health and our mood and our energy. And of course, when you feel tired, everything feels hard, right?
Course.
So I think women, because iron impacts so many different aspects of our health and our body, we normalize our experience. We're taught that iron deficiency is something that's so common among women, so we just kind of have to live with it. And our bodies do a really good job at accommodating. So if you've been iron deficient for months or maybe even years, you have learned and your body has adapted to live with it. So your symptoms can be in many ways manageable.
Yes.
Right?
Yes.
But that doesn't mean that your health is optimal or your biochemistry is optimized, because your body, and we could do a whole other podcast on cortisol and stress levels.
And we will have to. I was thinking about that, Dr. Leigha. You actually read my mind. I'm so sorry, Dr. Leigha. I'm going to jump in here because what I love about Our Rapport and the podcast is we're having a conversation, and it's like any girl sitting around the coffee table, wherever, having tea. But when you talked about iron and mood, that's exactly what I thought about: sleep, cortisol disruption, all these different things. So yes, we'll put a pin in that one to come back. I'm sorry I had to jump in, Dr. Leigha. Please continue.
I was going to say that cortisol is so rarely the problem in and of itself.
Yes.
Because it's what our body is experiencing, or what we're putting our body through, that causes our cortisol to become dysregulated.
Right.
So if we can help address anything that we have control over, you have control over your iron levels. And so if you can address that, then we help put everything else into place. And so iron forms such a foundational, our oxygen carrying capacity in our blood. So when you look at that, really everything from the ground up is related.
Oh, incredible. And you know, when we first started talking and we talked about women, and we put us in different age groups, and of course we go through different things in different age groups, I realized my brain, and I know, ladies, you're all going, my goodness, I never thought of iron for this, like you're saying about cortisol, sleep disturbances, all these different things. We probably didn't really think, what is my iron levels? We are going to come back and probably talk about things again, because it will help our valued listeners who are tuning in as well go, oh, that's right, they did mention that. This is how I deal with it. So talking about iron levels, I just wanted to jump ahead a bit on iron levels. Now, how do we have a reliable measure of our iron levels? Because what I'm hearing you say is, Genevieve and ladies, we have, of course, our ferritin storage. We have our serum iron, which we're using, which is our checking account. Ching, ching. Don't forget that. Dr. Leigha Saunders said it here first. And then we have to measure that. But we know the ranges in blood tests, they all differ. So, Dr. Leigha, help us, girls. How do we get a reliable measure of what's going on with our iron?
I love this conversation.
Yes.
I love talking about iron testing. So if we dial it back, take a step back for a moment.
Yes.
Hemoglobin, I have mentioned, which is our oxygen carrying capacity in our blood. We can make enough hemoglobin if we have iron. However, anemia, which is classified as low hemoglobin or low red blood cell count, is one of the last things to happen when you have been living with iron deficiency for a long time. So I want everyone to know that we cannot assess your iron on hemoglobin alone, because you can be iron deficient and still have normal hemoglobin levels, but they may be on the very low end. And again, we need to look at the person who is sitting across from us, not just whether their blood work is being flagged as high or low. What does it actually say, and how close is it to that normal range and being outside of that? So we want to then look at all of the iron markers if possible. So we've explained ferritin, which is the most accurate way of assessing iron stores, provided, and I want everybody to really listen to this and pay attention. If you take nothing else away from this podcast, take this piece. Yes. Ferritin is only reliable provided you do not have significant or elevated levels of inflammation in your body.
Oh, wow.
And so if we have inflammation, which so many people do, then our ferritin becomes what we call falsely elevated. So what happens in the presence of inflammation is that iron gets sequestered. So what's happening is that iron, when it's present in too high of a level or too high amounts, can become pro-oxidative. So it can be pro-inflammatory. Yes. So we want iron to be very tightly regulated. We don't want it to be deficient. We don't want it to be present in levels that are too high.
Yes.
And so in inflammation, we want to make sure that iron isn't readily available as iron, free iron, because that can contribute to more oxidative stress, more inflammation. Wow. So things like bacteria or viruses will feed on iron. And so when we have an acute infection, as an example, that is a great example of acute inflammation. inflammation. And so if you measure your ferritin while you have an active infection or active inflammation, you will see that it looks great on paper. It's going to be above 100. And I can give you so many patient case examples where we thought their ferritin was fine. We thought their iron levels had finally come up after years of being deficient, but their ferritin only looked normal because they had inflammation happening at the time they were tested. So one example I'll give you is I had a patient who happened to have appendicitis, and she had a follow-up previously scheduled with me at the end of the month. And so she had her appendix removed. And when she repeated her blood work a month later, her platelet counts were elevated, and something called erythrocyte sedimentation rate, or ESR, was also very mildly elevated, not outside of the normal range, but again, when we're looking at the numbers carefully, we could see. And her ferritin, for the first time since I had been working with her over 8 years, we had never seen her ferritin above 20, was 109.
Wow.
And we celebrated and we were like, hooray, you finally got your iron levels up. So I said, I want you to keep taking your iron because you've been deficient for so long. Let's retest it to make sure you don't drop off again. 6 months later, she had kept taking her iron and she repeated her blood work, and the inflammation was gone because she had still been experiencing like the remnants of that infection.
Of course.
And 6 months later, her inflammation markers were down. Her ferritin was 17. So we really need to run inflammation markers at the same time that we're checking ferritin. And if you look at your lab report, it will say that in the absence of inflammation, ferritin can be interpreted as follows, and it will tell you, but no one pays attention to that. No one knows, and no one actually reads that, and no one does run. Not enough people run inflammatory markers at the same time.
Wow.
And so that's where we want to tack on, because if you pay attention and also keep reading your lab report, it will say in the presence of inflammation, we need to use other markers to more accurately assess iron stores and iron status. And the key one there is something called transferrin.
Yes.
And transferrin saturation, or iron saturation. And so again, your body is innately wise, and we have this iron coming into our blood through food, and that's cash coming into our bank account, right? We need a way to move it from our blood to the inside of our cells to be stored as ferritin. So that's just the transfer that you're doing in your bank account when you're moving your money from your checking to your savings. And so there's a little protein called transferrin, transporting iron. It's very simple.
Wow.
And when we measure transferrin saturation, it's like how many iron are stuck on to that protein. So an analogy you can think of is a taxi, right?
Yes.
Because you can have 4 people inside of one taxi. And so that taxi would be saturated with people. We would be happy with that. But you could have one person and there's 3 taxis lined up. That's going to be a low saturation point, right? And so we need more people. We need more iron to sit in the taxi.
Yes.
And so if you have a transferrin saturation or iron saturation that's less than 0.25 or 25%, you are iron deficient regardless of what your ferritin is.
Interesting. Come on, ladies. Interesting. And Dr. Leigha, I love your analogies. I love the taxi analogy. But something you said here that just it's like an awe moment for me is about inflammation and how tightly that is really tied with your iron levels, etc. And we're going to have to talk more about that because, as you know, inflammation, it's another one of the buzzwords for all of us now because there's so much inflammation, and you're really the first one that I have heard put it in such phenomenal context of iron, how it ties one to another. And we're going to have to talk more about that and go more deeply in that later or in another show, because we could just keep talking about iron. What is one myth or misconception that, okay, this is what causes iron deficiency? So for me, one of the myths that I've always heard is severe anemia. That's the only time you have low iron. But you're here to tell us that there's so many other ways. What's another major myth? It's not just severe anemia. What are some of the things that are out there that this is the only time you have low iron? I know you talked about some of it before, but I'd love for you to repeat it for valued listeners and viewers.
I think that transferrin saturation is key, looking at that marker, because the other analogy that I will tell patients for iron and transferrin saturation.
By the way, Dr. Leigha, I have to jump in. I love your analogies. Ladies, her analogies stick. Please listen. And what I love about what you've said is if you ladies don't remember anything else, remember this.
Yeah.
So please give us another analogy about transferrin.
Transferrin saturation is like your financial advisor. So let's say we look at someone's savings account in their bank. To me, maybe they have way more money than I do. So I think like, whew, you have a really nice savings account. But maybe their lifestyle is much more expensive than mine. And so the rate at which they're spending, or the rate at which your iron is being used and lost by your body is higher. So that transferrin saturation point helps us understand if your iron stores are actually enough for your body's needs.
Oh, wow.
It's like your financial advisor sitting down with you and doing that financial assessment. What's in your checking? What's in your savings? What's in your investments?
Yes.
And saying, yeah, you're on track. You're on track for retirement. You're safe. You've got a cushion. Or saying the rate at which you're spending, you're going to become even more deficient, or you're going to run out, right? So then we can start to appreciate why so many women fall through the cracks. And I think that's the myth and misconception, is that we have to have like a hard cutoff for ferritin, because you can have a normal ferritin level. So now the reference ranges have been updated so that if you are less than 30, you are flagged as deficient. And if you are less than 30 and you have inflammation, we are very confident that you are deficient.
Yeah, of course,
so,
yes.
But if you are 32, as I was explaining with that patient before, and you don't have inflammation, then okay, you're kind of in this gray window. But I've also seen it. So that was a little bit more obvious because that patient was very symptomatic of iron deficiency.
Right.
I've seen it in patients much more dramatically, where let's say their inflammatory markers are actually elevated, flagged as high. Their ferritin is 100 and something. So if they had just looked at ferritin, they would be told they're fine. Their iron levels are fine. But that transferrin index, that transferrin saturation is less than 0.25, less than 0.2. For sure, we are very confident. That is well established in the medical literature.
Right.
And their transferrin saturation is 0.17.
Wow.
And so it tells us that they do not have enough iron in the bank for long-term health and success. And in the case of, let's say, elevated inflammation, if we treat the inflammation and we help that come down, and sometimes that's just time, right?
Yes.
Like my patient with her appendix, she just needed more time.
Yes, exactly. Exactly.
But sometimes it's also finding that someone's celiac for the first time and iron deficient, and needing to treat the celiac first to bring the inflammation down,
Right.
and then correcting the iron levels. And so I think if we start educating women on understanding it's so much more than just a ferritin level, because that's one, and it's a great screening tool. It will pick up a lot of women who truly are deficient.
Sure.
But if you have been told that you are fine and your iron levels are fine and you don't feel fine and you're checking all the boxes, or you want to take a deeper look at this, you need to run those other markers.
Incredible. Incredible. You know, Dr. Leigha, what I heard from you and what I love, and ladies, I know you appreciate this, is you looking at the whole picture, which is how you started. You can't just be very focused on one area, especially when it comes to iron. You have to look at so many different things. Is it there inflammation going on? Listen to the woman, primarily women sitting in front of you. On another show, we'll talk about, a much smaller percentage, but certainly men go through low iron as well. But listen to what's going on in this person. Listen to their lifestyle. Are they an athlete? What age group they are? But looking at the whole picture. And my goodness, I have so many analogies. Now I understand transferrin, and we're going to come back around to that.
I have one more analogy for you.
I want, ladies, we want the analogies. One moment, Dr. Leigha, before you go on, remember everyone, Dr. Leigha, we will put all her contact information right here at Walk with Wisdom. You can contact her and follow her. Of course, I'm sure you have social media things that we're going to follow you on. We'll talk about that more a little bit. But Dr. Leigha, incredibly learned on iron, and she has another analogy which I can't wait to hear. Please, Dr. Leigha.
The analogy is I want people to understand the inflammation and iron piece, because to your point, it's so prevalent in our society now. And so I can understand and anticipate people saying like, but why is my iron fine? Why is it elevated? Why does it look good on paper when I have inflammation? So keep in mind, your body is taking it out for a period of time to protect you from that ongoing or additional oxidation or inflammation. This is like putting money into a GIC.
Okay.
So you're going to put that money into a GIC. You can look at your bank account and you can see that you've got money, but you cannot touch it until that maturity date arrives.
Wow.
Right? And so the analogy there is like that inflammation has to come down, and you can expedite that by addressing the inflammation. But until that inflammation comes down, you have the iron, but it's locked away. It's not accessible to you. And when we have inflammation in our body, one of the things that also happens is that the gut downregulates the absorption of iron.
Oh, wow.
So now we have a double whammy where we might still be consuming iron, but we're not absorbing it. And any iron we have in our body is now being sequestered into that GIC, into that right internal storage, but it's not actually accessible for use because we need this equilibrium to be available to us. We need that ferritin to be able to bind to that transferrin, go to serum iron to be transported to the different tissues in the body for all of the things that iron does.
Right. Dr. Leigha, incredible. Your analogies are phenomenal because analogies give us pictures. And so I already have pictures so much more. And again, being somewhat learned in this area because of my background in health coaching, nutraceuticals, lots of iron supplementation, which brings me to that when you're talking about putting it in a GIC. By the way, I have a finance background. So you're talking my language on so many areas. I'm picturing myself as from, bank teller, investment advisor, all of it. But certainly one thing that brings me, we have to talk about this right now. We're going to change up the order of questions a bit, but it's really about iron supplementation. So something that you said that I thought, let's just talk about this now for valued listeners and viewers is, the iron could still be sequestered. If your gut is off, then, now it's downregulated. Now you're not absorbing it, but we still need iron. How does the whole supplementation piece comes in? And because here's the thing, if we're feeling a certain way, we are low iron, we have all these other things going on in the background, and now we're supplementing with iron, does it then mean that it's best for us to, of course, have an iron that's more absorbing all of that? Can you kind of speak to that? Hopefully that wasn't a convoluted question, but I was just thinking, we supplement with iron, and where is it going, and how do we know what to supplement with, et cetera?
Yeah, or a question that some people I can anticipate might have would be like, well, if I'm experiencing inflammation and taking iron, am I contributing further, right?
Yes.
So when I measure ferritin and those other markers in my patients, I'm always measuring inflammation at the same time.
Excellent.
And if they are acutely inflamed or even chronically inflamed, so if the level of inflammation is significant, we are probably going to choose an alternative route of administration for iron if they are in fact iron deficient. And in most cases, we're also going to wait for that inflammation to come down.
Of course.
Right? And so there are some cases where someone might be, let's say, acutely inflamed. We can see by their transferrin saturation they're deficient, but their ferritin looks okay. So we're going to wait and then retest and see where things are at. There could be someone who has kind of this like low grade chronic inflammation and still showing iron deficient. And so we might jump to something like an IV iron in both of those cases, especially if someone's inflammation is coming from the gut.
Right.
Because when we're trying to deliver iron through the digestive tract in the presence of inflammation, it's just not going to work. It's going to make it very challenging for absorption to be efficient, especially if somebody has an underlying condition of malabsorption like celiac or Crohn's or colitis. So that's kind of the first thing I'm typically looking at in a patient is to say, do you have inflammation? Do you have something else going on with your gut? Because the most common side effect with iron supplements orally is digestive related,
Yes.
right? So nausea, constipation, or digestive upset and discomfort.
Right.
And so in someone who maybe already has a susceptibility towards that, we may not want to add fuel on the fire right away, right?
Of course.
And so that's then where we're looking at how deficient is this person to then determine how much supplementation they might need. Going back to what I said at the beginning of like, I bring my patients to the buffet of treatment options. And so in someone who's really deficient and wants to feel better fast, which is most of us, then IV iron is an incredible tool to replenish iron levels very quickly and is generally very well tolerated. So that's one option I'll present. Some people are more inclined to go the route of oral supplementation. Maybe they don't like needles. Maybe they don't live close to me. Maybe they don't want to travel for the IV, or the cost of IV iron is significantly higher as well.
Yes.
So oral supplementation might be better.
Yes.
So again, we're typically then looking at and saying, okay, let's make sure we have limited to no inflammation in the gut, and then we can start implementing oral supplementation.
Of course. That's amazing. And, for me and a lot of patients, of course, I know about the IV route, and that's why we always tell everyone when we're talking, go ladies, we're talking here, see your primary care practitioner, like Dr. Leigha Saunders, ND, to be able to read those numbers and tell you what the best route to go is. Now, oral iron is something that has come up. We hear about it all the time, and you said something very, very apropos. Stomach upset, constipation. Now, are there I know that iron, there's a myriad of different irons out there. Can we just talk about oral supplementation for a bit? Are there differences in the absorption of certain supplements, iron supplements that is, and what is it that a woman would look for the absorption factor, as well as the constipation factor? And so I think, what I'm asking is because some iron, they're just bound with different things. So please, with your expertise and what you've seen, what's the differences between oral supplementation?
So the iron salts are most bioavailable. And that meaning like they're most efficiently absorbed. So that would be the things like our ferrous fumarate or ferrous sulfate. And there are other varieties as well.
Sure.
And so we want to look at a couple of key things when it comes to oral supplementation. What is the form of iron that you're supplementing with? So outside of the salts, there's also iron complexes like iron polysaccharides or iron bisglycinate. All of these different formulas are attempts to get that iron in a more absorbable form that's well tolerated. Because if we go back to what happens, most common side effect is digestive related because iron is inherently challenging to absorb. And so when the iron that isn't absorbed, let's say you're taking a 100 milligram capsule, we're typically only, if we're lucky, maybe absorbing 20% of that. And so you're getting 20 milligrams of that 100, but the 80 milligrams is sticking around in your gut.
Yeah.
And that is what's irritating to the gut and creates the symptoms. So the side effects of iron supplements are also dose related. The higher in dose you go, the more likely you are to experience a side effect. So we have to pay attention to the dosing because some of the forms that claim to be gentle will be in lower dose.
Yes.
Right? And that makes sense. Okay, you're getting a lower dose in a form that's easier on your gut, but you may not actually be getting enough of that to correct your deficiency. Especially in the context, if we look at what is the most common reason that women are iron deficient, it's because of heavy menstrual periods and the iron loss associated. So again, if your loss is exceeding what you can take in orally, or what you can get from a minimal dose supplement, we have to make sure you're getting enough. So dosing counts a whole lot. And the sweet spot is really between 60 and 90 milligrams per day. When we exceed an intake of more than 90 to 100 milligrams of iron, we can induce the whole cascade of hepcidin, which sounds like this, like, I always think of it like a movie title or something for some like robot.
Right.
But hepcidin is a protein that gets engaged in order to prevent iron overload. The key thing here is like find the dose, and of course, in the context of working with your medical practitioner,
Yes.
because yes, the more deficient you are, the more iron you're going to need, and everybody responds differently. So as a doctor, I'm looking at my patient and saying, okay, how deficient is this person? Are they less than 30? Are they 3 or 5? Or are they 28 or 29? Are they 35? Are they 50? Are they 75? And I'm referring to ferritin levels there in the absence of inflammation to keep things simple. So I will choose different levels of supplementation in terms of dose according to how deficient somebody is.
Right.
Relating to the fact that the more deficient they are, yes, the more iron we want to give them, but we want to be mindful to not give them too much because that's going to increase the likelihood of side effects. And always listening to the patient's experience, because everybody responds to iron differently. And we don't have great head-to-head trials that put patients on 2 different forms of iron and compare how well they absorb and how well they're tolerated within the same trial and groups of people. And so in that way, I'll have some patients who will come in and say, well, I've tried iron, I've tried supplementing, and it just really upsets my stomach. And we'll review, okay, what form, what was the dose, and them trying a different kind can make a big difference.
Yes.
And then you always want to check and look at the label.
Yes.
And understand what else might be in the product, right? Are there a lot of fillers? Are there a lot of binding agents? Are there other things that you might be intolerant or sensitive to? Is it a tablet versus a capsule? Because sometimes and often we are more easily able to break down capsules versus tablets just by nature of what they're made of, and that tablets have a lot of binding agents in them. What other cofactors might be in the supplement? And so typically taking iron on, one of the myths, actually misconceptions, is that you have to take iron with vitamin C. Right? And where does this come from? Iron is more efficiently absorbed in the gut in a low acidic or like a low pH or a highly acidic environment, right? So when you have a acidic environment like your stomach from stomach acid, you take iron, then it can be absorbed fairly readily. Vitamin C is ascorbic acid. It lowers the pH, increases the acidity of the stomach, and so that's where the enhancement of iron absorption comes from with vitamin C. But actually on an empty stomach, just the presence of stomach acid and hydrochloric acid is enough for iron absorption.
Interesting.
But a lot of formulations will include vitamin C because it does help. On that note, there's a lot of things in our diet that can contribute to iron absorption being blocked or compete with iron absorption. So coffee and tea, because of the polyphenols and the tannins.
Yes, that's right.
Calcium-rich foods.
Yes.
So typically dairy, but other foods as well. And fiber. Fiber will just bind anything.
Exactly.
Yeah. And so if you're taking your iron supplement in the morning with your coffee that has, your choice of calcium-rich non-dairy or non-dairy milk, cream, then you're not giving your body the best opportunity to absorb that iron. You're still going to get some of it. So I always say to my patients, because people always ask, like, well, when is the best time? I'm like, the best time to take your supplement is when you take it.
Because then sometimes they just get so confounded. Well, I can't take it now because that's going to happen, and then they don't take it at all. So I love that.
The best time to take your supplement is when you take it.
Exactly.
And then some supplements are a little bit more nuanced, so iron being one of them.
Yes.
My most common recommendation when it comes to timing of iron is to take it at bedtime.
Oh, wow.
And you take it at bedtime because you typically are then, it's like been a while since you've eaten.
Yes.
You're taking it typically then on an empty stomach. You're taking it away from coffee and tea. I mean, most of us, I hope, aren't having coffee or tea right before bed. And the calcium-rich foods aren't often like in close proximity to that intake as well. So I recommend people keep it on their bedside table or by their toothbrush.
That is incredible. And Dr. Leigha, if you can believe it, we have been talking iron, ladies, for About an hour, a long time. We're going to break up our iron talk. I am so glad, and ladies, we have a surprise for you. I knew that we couldn't talk about iron in one sitting. So the amazing Dr. Leigha Saunders has agreed to come back with us, do another talk about iron. And you know, what I would love for us to continue on is about, what's the easiest way? So I think what I've heard through all this is most women are low iron. It's across the stages, certainly at different stages of our lives. We have different iron deficiency needs. However, we have to look at the whole picture to make sure there's no celiac inflammation, all the different things going on. And we have to look at lifestyle. If we're an athlete, riding, I know people who ride like 100 kilometers. I'm going, what? Why? Okay, that's just me because I can't ride a bicycle. Maybe that's a part of it. But, so there are all these different things. And so I really look forward for when we talk again to talk about just the supplementation piece. I know of irons that are bioavailable. You mentioned the bioavailable word, and it has the cofactors, which are things that help to pull it out of the stomach so that it doesn't cause that digestive upset. And it's non-constipating because you're actually pulling it out of the stomach. Now you're absorbing it. I loved how you broke it down to the time of day to take iron because I get that all the time. And my friends will call me up because they know that I'm around amazing naturopathic doctors like you and go, what are they saying? You heard it from Dr. Leigha here, folks. And so I would love to continue our conversation around iron, the best way to supplement, hormonal effects on iron, etc. Dr. Leigha, for this first walk with wisdom or walk with iron, oh, I like that. For this first walk, there's so many things that you told us that's overarching and amazing. You gave us so many incredible analogies. What is one thing? I know it's hard. I'm sorry. However, what is one thing that you'd say, ladies, if you don't remember anything else from this first walk, this is what you should take away about iron in general?
Before you jump to anything else, make sure you've had the opportunity to do a very thorough investigation of your iron levels with all of the panel markers that we've talked about with someone who's going to take you and your goals and concerns seriously. Because the number of times that I have had the wonderful pleasure and privilege of working with women who have been dismissed and who have been sent to so many different doctors, so many different specialists. And I say to people, like, there's no wonder that they feel insane, right? There's no wonder that they feel dismissed. There's no wonder that they go down rabbit holes of wondering what's wrong with them and thinking that they have some rare and mysterious condition because something's been overlooked in the first place.
Yes.
And so make sure that you've had the opportunity to adequately assess with someone who has a really great understanding of iron and is willing to look at you as a whole person and take everything that you're experiencing into consideration and context.
That is phenomenal. Dr. Leigha, on that, I thank you so much for joining us on Walk with Wisdom. Ladies, this is just the first walk. Dr. Leigha Saunders is coming back to talk to us further, deeper about iron. We could talk about iron for months.
Long time.
Right?
Yeah.
So thank you so much for that incredible introduction. Thank you for leaving us with that incredible piece of making sure that we get tested correctly. Ladies, Dr. Leigha Saunders' information will be here at the end of the podcast. We'll have all the different ways that you can contact her and certainly, of course, here through Walk with Wisdom. I look forward to us walking again. Thank you, Dr. Leigha.
Thanks, Genevieve.